Hello, everyone. A very good evening to you all. Myself, Dr. Sumedha Gupta, and on behalf of Voice of Healthcare, I would like to welcome all the viewers who have joined us today. So, the topic of today's session is Heroes Fight for Health, Join the Prostate Cancer Awareness, and this initiative is supported by Zydus Life. Prostate cancer is a significant health concern in India, ranking as one of the most prevalent cancers among men. According to WHO data, prostate cancer accounts for approximately 7.7% of all cancer cases in Indian men, with an estimated 1,05,000 new cases reported every year. Additionally, it is a leading cause of cancer related deaths with around 30,000 fatalities in 2020 alone. These statistics highlight the urgent need for enhanced early detection, prevention strategies, and treatment options to address the growing impact of prostate cancer in the country. So, in this session, we are going to discuss and highlight the holistic prostate cancer care by integrating physical, emotional, and psychological support. To begin with the discussion first, I would like you all to join me in welcoming our expert who is going to provide us with insightful information on understanding about the prostate cancer awareness. So I would like to welcome Dr. Bharat Bhosale, Senior Consultant, Precision Oncologist, Bombay Hospital, Mumbai, Sir H.N. Reliance Foundation Hospital and Research Center, Visiting Consultant at Jaslok and SL Raheja Fortis. Good evening, Dr. Bharat. Welcome to the discussion.
Good evening, Dr. Subeda, and thank you for having me here. And looking forward for a discussion which may be helpful for people around who are undergoing treatment or relatives who are taking care as a caregiver. And I would really appreciate the way this topic is designed. It is for the caregiver and the patient and the support groups. So let's see.
Thank you, Dr. Bharat. So let's delve into the discussion. So, if we talk about the patient advocacy and support groups and how prostate patients can get the benefits, what are your views onto that? That what role does the patient advocacy plays in improving treatment outcomes for the prostate cancer patients?
So basically, when we talk about the support groups, it's for many cancers. So it can be for geriatric patients as well who are suffering from debilitating diseases. So when we specifically talk about prostate cancers, yes, it is a need because you understand these are the males. Obviously, prostate cancer happens in males, largely males, and it is one of the important cancer, not in terms of number, because cancer is a disease of old age, right? Old age is an important risk factor for cancer, and prostate cancer in males is one of the important cancer because every male has to undergo the aging, and the prostate problem starts after 50s, largely. Very rarely it starts before 50. And this is the age, like after 50, it can happen at the age of 90 also. And this is the age where the person, especially naturally also, they have their own problems. Most of them already feel the isolation because we know the isolation is a problem of old age. And when you come to the complaints of prostate cancer, largely these are not discussed publicly, right? So at this age, the urinary complaints or all this happens because of the benign enlargement of the prostate. So those complaints and the prostate cancer complaints most of the time are similar, right? So discussing these problems in a forum is also important. We should not neglect these problems. So complaints like frequent micturition of night, getting up repeatedly for the micturition, not passing urine, or when it goes to the advanced stage, sometimes back pain starts. So these complaints, they have to understand, get to the healthcare in time, get properly, the test done, which includes the PSA, whenever required, the sonographies, biopsy for the confirmation, and then we'll talk about those investigations subsequently. Why it is important, not attributing only these symptoms to some benign problem, as I mentioned, the benign enlargement of prostate, which eventually happen in all males. And that also leads to these problems in some of them, and you may end up missing the diagnosis in the early stages. So this communication happens between two patients and they share their experience, whichever, no, it's be it a malignancy or non-malignancy, that leads to a level of confidence to reach out to healthcare to get the investigation done. First of all, to rule out whether it's a cancer or not, and subsequently then what is the stage. Because the good thing about prostate cancer is even if it is a cancer diagnosed, you look at the people even in the stage 4, they are living longer, 10 years, more than 10 years. So the right diagnosis in right time, staging properly and choosing the right treatment happens when you have a discussion with the doctor. Now the problem is that you have a limited time for the discussions with the doctor. You go back, and then you always have this in mind after the diagnosis that there is a cancer happen. Okay, and as I mentioned, this is the age of isolation. What at this age, if somebody is not working, right? Are you understanding that they are
Yes.
continuously thinking they don't have a support? Obviously, they can talk to the family members. Then again, everybody is not privileged to have a big family to talk about. The caregiver is the person who always bring the patient and take back the patient. He is also suffers a different level of anxiety when we break the bad news. We call it as a breaking bad news. Then the patient goes back to the home, goes back to the family physician. The family physician looks after the minor problem, but the family physician is not an oncologist always, right?
Yeah.
Then in that situation, if you have a support group which can empower you with the right knowledge, which helps you to fight this disease in a better way, and this disease to tell you that the patient can live for 10 years and more. So there are so many questions they have to ask, get the answers, right from doing simple tests, from where to do it, or doing right imaging, going biopsies, doing no tests, getting procuring medicines. If there is a research going on for newer medications, all these informations can be discussed transparently. There can be negative use, positive use, because every patient is not going to have a similar biology of the disease. Some patient may
Yeah.
have an aggressive disease, some patient may live for 10, 20 years, but at least there are good examples. There are side effects being discussed so that patient can be proactively design a set of questions when they come and see us. So that I feel very strong point where I can say support group helps. Obviously, support groups can lead to so many questions in the discussion. They talk about Ayurvedic medications, as you know, they help. I am not about so people come to us and that you are chemotherapy doctor, chemotherapy harms, and then I have alternative treatment like Ayurvedic. But then I'm not against any pathy, but you should have a right information. Obviously, chemotherapy has toxic effects. It affects heart, it affects liver. The patient has every right to know the bad effects as well. But there are newer treatments, hormonal treatments. There are treatments which are not targeting radiation delivery right at the cancer cell. Then we can know why the disease has actually occurred. There are genomic tests can be done, which are called as a precision medicine. If there are some mutations are happening, then you have a targeted drugs which specifically looks after that subset of patients. So these things should be discussed transparently. At the end of the day, if the patient wishes to take treatment, doesn't want to take a treatment, it should be an informed decision. And then you can have an alternative treatment, homeopathy, Ayurvedic, that is his call. But then patient should obtain all the information, and then he becomes empowered with the knowledge. So that knowledge doesn't only always come from the doctor, but it always all those questionnaire comes from the support group discussion where patient comes to know, "Arey bhai, ye bhi hota hai. Oh, this also happens. This treatment is also available." So some patient can fly to any center to get that research protocol. If there are some drugs are tried in research, which comes into actual practice after so many years. So somewhere if research is going on, if there is a patient who has benefited out of it, so he can share that experience. So it starts from the screening, doing investigation, doing treatment, scanning, everything, being discussed. And I am part of few of the groups, and I'm very happy that they are, the discussions are, obviously the discussion has to be healthy, there has to, you can't have only negative things. Then you meet a person and no, he survived only this much. So prostate cancer, largely for the viewers, I will tell you, the patient do very well. They have a good quality of life, and I have been treating patients in 90s. They are doing good. So that is what support group we look at. Create knowledge, uh, and the knowledge should be in a direction to strengthen, because these patients have emotional needs. Old age comes with this challenge. And the
Yeah.
part of the breaking bad news that you have a cancer, it's a big impact, and you need subsequent counseling not only of the patient but the entire family. And the person who is taking the patient, as I mentioned, caregiver, the immediate caregiver also needs some support, right? Kahan pe
Yeah.
jana hai, where to use this test, where the test can bring down the cost, because cancer treatment is very costly. So one has to get right information, but not compromising the quality is also important, right? Just because you are getting something. So all the treatments are good, any whatever recommended, but if you have a better scientific evidence for that, that needs to be accessed by the patient. And
Thank you. Yeah.
yeah. So support groups helps in that way, I feel.
Thank you, Dr. Bharat, for enlightening this and tell us about the crucial role of the support groups and the patient advocacy roles play. Moving ahead, if we talk about the treatment plans, so matlab, how can a multidisciplinary team contribute to the comprehensive approach of the prostate cancer care? So, how do you see this, and what pointers you really want to share onto that?
So that is a very good question. Multidisciplinary team, uh, it's a thought process of all the specialties which are engaged in the treatment of the any cancer, not only prostate cancer. But it doesn't limit your discussion to only these doctors who are basically a surgeon, who is a urologist, neurosurgeon, because patient usually presents with a prostate problem to a neurosurgeon, where largely the investigation happens. But nowadays, many patients directly approach me as a medical oncologist. Medical oncologist who looks after the systemic treatments, the hormonal treatment. Your hormonal treatment has to happen under a medical oncologist, because these are medicine guys who can look after the side effects better. Obviously, surgeon does the surgery job. Then there is a third component called as a radiation oncologist. But this comes into picture when the treatment is being planned. Before that, there are radiologists who actually diagnose it, confirm with the biopsy with the help of the urologists. So their role is also important. The radiologists have a different, those who do the MRI, and there are nuclear physicians who are also kind of radiologists who do those PSMA scans and PET scans. So this is important for, first of all, confirmation of the diagnosis that yes, this is cancer, and not like a simple thing which I mentioned as a BEP, which is a benign enlargement of prostate, which is a simple enlargement of prostate. So they do biopsy, they do MRI, they decide whether it is localized to that part of the body or it has spread to the other part of the body. So that will decide the stage of the disease, and then comes for the discussion. And in the discussion of what you mentioned as a multidisciplinary team, where we sit and discuss whether this patient needs a surgery or whether this patient, first of all, needs hormonal treatment, which are injections given monthly or 3 monthly to bring down the size of the tumor or the PSA, because investigation largely includes PSA, which is a blood test, which if it is raised, then we do the sonography biopsy, which is called as a transrectal ultrasound guided biopsy. The biopsy has to be done by the expert person who knows how to treat the prostate cancer. And then based on that, we have this biopsy, the PSA high, and then MRI or PET scan if it is done, which will decide what is the best possible approach. That approach, and coming to that conclusion, is the result of multidisciplinary team discussion. Now you have decided surgery for few patients. The team can decide radiation for few patients. The team can decide neoadjuvant hormonal treatment, which is giving some injections, and then after down the line 6 months, 8 months, you evaluate and then decide whether you want to do surgery or you want to do radiation or you just want to continue hormonal treatment or anything. If the patient is in an advanced stage, whether the hormonal treatment can be a surgical removal of the testis or the patient requires chemotherapy and newer anti-androgens, which are hormonal treatments. All these discussion in depth are decided. Now, beyond this, there are NGOs, social workers are part of the multidisciplinary team, because some patient cannot afford the treatment, right? Some patient need, so as I mentioned, prostate cancer is an old age group. Patients have already the emotional needs, and when you come to know this breaking bad news, the emotional support is very, very important. A doctor cannot afford after treatment all the time, have that much time, because somebody is seeing 50 patients. Imagine, they have to deliver the care, and then this is helpful for the doctor as well if they have social support in the form of social workers who are sitting there and counseling the patients after the diagnosis, because sometimes the outcome is very good. You need to induce a positivity inside the patient. Yes, though it is a cancer, you have years ahead. At this age, our main goal, survival, is in our hand, but the quality of life, the complications, how we can reduce that, the financial stress, how we can reduce that, from where we can get the funds. There are NGOs who are ready to fund, but you need to channelize that properly. So all these things are, the social groups or the NGO or the social worker are also important part of the multidisciplinary, because in India the challenge is, the financial toxicity. Because in Western country, you write any treatment, even if it is 10 lakh rupees, the government is going to have insurance, and somehow patient gets, even if it is not, then at least you have clinical trials going on and you get through the
Yeah.
clinical trials. But in our country, we have different challenges. So there, I feel no support group help a lot. And in policy making also, as you told, it's a topic which you are also interested in, the policies and how the policies are designed. Support group in a way influence, you know, for the benefit of the patient. Because some drugs, suppose there are no different taxes or procurement charges if the drug is coming from Western country, poor patient is paying
Yeah.
out of the pocket. So how we can reduce the cost by reducing the charges, which actually it's in the hand of the government. Some policies which are helpful, like there are vaccinations. How we can get into the policies, how we can implement it at public level, so that prevention is better than going for all these treatments. So all those decisions in a clinical trial, the patient support group has a say, over there. So largely now, every big conference of oncology involve all these people to put up their how we can do the care better. So yes, support groups are very very important. And prostate cancer, yes, because here we are dealing with the geriatric age group.
Yeah. Well, thank you, Dr. Bharat, for such insights onto that. And we talked about the treatment part and the advancement part and the clinical trial part. So, can you please brief us about the latest advancement in prostate cancer research and how this could improve the patient outcomes and care?
So traditionally, if you see, largely when the patient gets unnoticed, these symptoms they present with advanced disease, means the tumor might have gone to, largely it goes to the a large proportion of cases it goes to bone. Sometimes it goes to the visceral organs, lymph nodes, and very rarely to lungs and other parts or liver parts. So the basic treatment for prostate cancer is a hormonal manipulation, because this tumor is dependent on testosterone. This stimulates the prostate cancer cells, and that is how it starts and spread to the other part of the body. So initial
Yeah.
treatment, if it is localized to the prostate, yes. If it is very small, surgery is the basic treatment. And based on the staging, after the histopathology report, you can decide whether the patient requires hormonal treatment or radiation, or nothing is required. Beyond that, if the tumor is bit larger, upfront surgeries are not a way forward. As I mentioned, you give injections, bring down the size, either do surgery or radiation. And after radiation, after surgery also, sometimes patient require radiations if the margins are positive. So this is largely for the tumor which is limited to the pelvis. Beyond that, if it is spread to the other parts of the body, the treatment is hormonal. Now traditionally the testicles are removed, which is called as therapeutic. No, you have to remove the source of testosterone. But somebody doesn't want to do the surgery, they can opt for injections, which are given monthly, 3 monthly, and that helps to reduce the testosterone level. But then it has to go on continuously. We'll call it as an androgen deprivation therapy. So here there is no need to remove the testes, but you keep on taking the injections. So that helps to prolong the survival. Beyond that comes the chemotherapy, which are 6 to 8 cycles of chemotherapy every 3 weekly. But patient has to be fit. No, you have to monitor the side effects. But largely patients who doesn't have any heart problems, diabetes, hypertension are controlled. They do tolerate these treatments. And apart from chemotherapy, there are oral hormonal treatments which the patient has to continue, and that also adds years to the life of these patients. Yes, there are newer oral drugs are coming up, and they are better than the first generation drugs with lesser side effects. There is something called as a radiation. If the patient has the disease spread to the bones, and if it is causing there is a risk of getting fracture. The delicate sites like the spinal bones, which if get fractured, then patient may end up in losing the powers in the lower limbs or sometime in the upper limbs, where you can actually give the radiation, which is called as a palliative radiation. So these are also advances. Then there are bone modifying agents, because these tumors goes and sit in the bone and cause the bone weaker or resorption, which leads them to causing pain or fracture. You give this injection monthly or 3 monthly. These are called as a bone bisphosphonate, bone modifying agents. So these injections also help the patients to make the bone stronger, reduce the chances of fracture, reduce the chances of pain. Beyond that, there is something called as a nuclear medicine, where we do PET scan, PSMA scans. These PSMA scans are kind of latest PET scans where they actually go and show that these are the tumor cells which are expressing this PSMA, the prostate specific receptors. And if there is a positive uptake, you have a treatment which is a nuclear medicine, which actually go and hit on this, binds these particular PSMA expressing tumor cells, and then the radiation dose which is goes there at the tumor site, gets inside the tumor and emits this beta radiation and kills the tumor cells over there. So this is also a latest treatment in prostate cancer, where this nuclear medicine doctors help us to deliver this treatment right at the site of the tumor, even in the advanced stages. And latest research is that it has shown that it also adds years to the patient. Now you have so many treatments, you need to put one treatment after the other. Okay, so
Yeah.
you use one treatment, prolong the survival, it fails, you use another treatment, then third treatment. So some of these patients develop this tumor because of particular mutations. So you must have heard about Angelina Jolie, she has BRCA positivity. Her mother had breast cancer. Similar kind of a BRCA2 gene is responsible for the cancer in prostate. So if that patient has a family history and if the gene is affected, you can actually check out the genetic mutation test after germline counseling, and if that is positive, there are treatments which can are useful in such situations. So day by day we are getting more and more treatments. Some of the very rarely patients respond to immunotherapy, but that again very small fraction of patients. So many treatments are coming up, but yes, you have to. Research is going on in CAR T also, but yet to be proven that CAR T therapy, which is chimeric antigen T cell therapies, these are immune cells which are taken from the patients, are modified genetically, and again go back to the patients and kill the tumor cell, which has been successful in lymphomas and T cell leukemias. The trials are going on in the prostate cancer also. So far, it is not successful trials. The research is going on. So many treatments are coming up, and the future is good. But as I said, prostate cancer patients usually have a longer survival. What you have to target is a good quality of life. You have to take a wise decisions. Even if you have so many treatments, the treatment comes with the side effects. So support group people help over here. They have experienced patients in the support group. Somebody who is surviving for 10 years, gone through all these treatments, he can share the experience with the patients and empower the patient to take the right decision about their own treatment. That's what the beauty of these support groups, and build up confidence.
Well, very rightly said, and it's really enlightening to know about the latest developments in the physical treatment. So, we talked about the physical treatment and methodologies. I would request you to please tell us about what uh, what role does the physiological and emotional challenges that patients face after a prostate cancer diagnosis, and what supported resources are available to address the same, and how they can tackle this situation.
So, see, this is very important. Now we have 6-7 minutes, so we'll utilize these minutes for maximum discussion. So, first of all, is the diagnosis, breaking bad news. We call it that somebody, when as a doctor tells, there has to be a systemic way to tell. You have a caregiver, you have a patient, you have family. So, first of all, the emotional impact. There has to be emotional support to digest the diagnosis. One has to understand that this disease is not the death sentence. There are years after that. Now you have to plan that in properly. The age is fragile. Somebody can be get diagnosed at 90 year, 70 year, 80 year. What is important, prostate cancer patient has to understand that what is the survival at that age, normally even in the absence of the prostate cancer. And while choosing the treatment, they have to decide, I am not affecting that by adding treatment. So somebody says 90 and bedridden gets diagnosed with prostate cancer. So not necessarily, and the prostate cancer is grade 1. Even if you don't treat, the patient will survive more. If you try to treat that, will end up in getting more complications. Those discussions are very important. The emotional impact, I told you that we have to tell based on how good is the disease. Obviously, cancer is bad, but then if some tumors in prostate cancer to tell you, if you do biopsy and they are very low grade and sitting over there for years, sometimes we ask the patient, why you want to operate? Just hold on it. That discussion, those kind of discussions should come up into discussion with the doctors so that we can take a right decision. Now, suppose we decide for the treatment, as I mentioned, the hormonal treatment. So I mentioned about taking out tested or giving injection to reduce the source of testosterone. So in a male, when you talk about reducing the level of testosterone, the patient has to face the challenges, physical challenges. You mentioned about the physical needs. The androgen deprivation leads to a lot of problems with the patients because they lose muscle mass, the bone density goes down. Sometimes it affects the mentation, and this is the age where no even a simple fall can lead to a fracture. So patient education regarding these side effects is very very important. You take the chemotherapy or not, that is different story. But simple hormonal treatment also can cripple the patient. But if the patient plan this treatment proper way, does proper exercise, build up muscle, take a proper diet, take a help of the relatives when walking around, no, when their bones are not strong, avoiding a simple fall with all this taking care is very very important rather than what you know spend crores of rupees on the treatment. So quality of life is important. Again, it is very very important. Patient has to understand what are the side effects, what are the side effects of the newer hormonal treatment, what are the side effects of the chemotherapy, what are the side effects of the radiation, and then accordingly life they plan their lifestyle, their diet. All these decisions can be taken in a better way. So yes, there are so many physical toxicities, simple toxicities, that they can be dangerous if they get a fracture. So patient has to learn this. Patient has to understand this. So this is about the physical part. Emotional part, they need continuous support, right from the digesting the diagnosis, getting along knowing that now there is a cancer. These are the treatment options. From where the treatment, better treatment. No, in the case we can get the medications in supported way. If there is a financial issues, what are the institutions where you can reach out for the help? All these things, I think, the can be discussed without hindrance in the support group because patient might not open up with all the problems in the limited time which they have to discuss with us. So in those situations, all these problems can be discussed. As I mentioned, there are clinical trial informations. Obviously, these patients, if there are hundreds of patients in the support group, you can get discussions going on for all the sorts of things regarding the prostate cancer, right? From simple biopsies, what are the biopsies? Because if you get a biopsy report on Friday and you are going to meet a doctor on Monday, patients know how to go through that anxiety for 2 days. So if you have a group which is open for discussion all the time, they can put up, and with the social media thanks to they can put up the message in the middle of the night also. If somebody is awake, they are also enthusiastically reply, because this age group needs our attention. Unfortunately, without cancer also they do suffer from
Yes.
the emotional issues. And you have adding you are looking at a group which is already emotionally vulnerable with a diagnosis which is again damaging mental peace. So yes, these groups are important, and we need more and more groups in the society.
Very rightly said, Dr. Bharat. So, moving ahead, in order to conclude this, what recommendations or maybe what suggestion you want to give to the patients who are newly diagnosed with a prostate cancer or at the risk of this?
So see, my message as a oncologist or treating, I have been treating prostate cancers in more than 15, 20 years. So to tell these people, no, my patients or no public, see, don't uh, get it as a negative news. If you look at other cancers, this is the cancer where no, you have years ahead of you. Discuss properly with the caregiver, your friends, your treating doctor. Resolve all your queries with, get proper information, because this disease gives you time. If treated properly in early stages, it is completely curable. Even in stage 4, this is one of the cancer where you can simple hormonal therapy can give you years, which I would say a patient of 80, if he survives 5 years, it is cure only when it's stage 4. So I label it is cure, because normally also at the age of 80, if you look at the survival, which is for the next 5 years, is not 50%, because at that age you have other problems also. You have diabetes, hypertension, certain heart attack also can cause a problem at that age. So prostate cancer largely curable. Even in stage 4, it can be controlled to the extent that I can say it is curable. That positivity has to come into mind. Discuss with your doctor all the possible treatment option and choose those which gives you best quality of life. That is very important at that age.
Thank you, Dr. Bharat, for enlightening us with such recommendations. And in conclusion, our objective for today's discussion was to explore and emphasize the importance of holistic prostate cancer care by integrating physical, emotional, and psychological support. And I'm confident that our experts have addressed this topic comprehensively and effectively, presenting the information in a manner that is both thorough and accessible. I would like to extend my sincere gratitude to Dr. Bhosale for his insights, contribution, and for sharing the expertise with us today. Your participation has been valuable, and we deeply appreciate the time and knowledge that you have shared. Thank you for joining today and contributing to this important conversation. Thank you so much.
Thank you, Dr. Smith. Thank you so much.